Hey, welcome back to Healthcare Consumerism Radio. This is Doug Fields, CEO of the Institute for Healthcare Consumerism, along with my co-host and managing director, Brent Macy. And very pleased having us on the program. On this segment is, Jeff Everson, who is Senior VP, Chief Sales Officer for the largest vision care company in the United States, VSP Vision Care. Jeff, good morning.
Good morning, Doug. Brent, how are you?
We're great. Hey, good to have you here. Thanks for taking the time. Give our audience just a brief background on the VSP, but then we want to get into talking how the world's changing as far as accessibility to vision care.
Sure, happy to. Well, VSP Vision Care is the largest not-for-profit vision benefit service company in the world. And we've got nearly 71 million people covered throughout the world, a network of 30,000 doctors, U.S., Canada, Ireland, and Australia. And we're growing.
Yeah, congratulations on that. How do you see your world changing as far as and the consumer and employee and the the individuals out there? World's changed as far as vision care and accessibility to vision care.
Yeah, well, and we're excited about the changes, yeah. Doug. It's been a very successful year for us. In 2014, we've added, I mentioned the number earlier of 71 million. Yep. In the U.S. here, we've added over 6 million new members. A record year for us, and a lot of that's due to the various channels at which we are distributing our benefits. See, our goal as a not-for-profit vision care company, VSP, is we want people to have access to quality vision care regardless of where they get that coverage. We've added some channel partners. We're represented on most all of the private exchanges. Mm-hmm. We're growing our direct-to-consumer individual business. For the public exchanges and health plans, we're adding partners there. And we're seeing continued strong demand in 2015. So the changes in the healthcare delivery seem to be creating additional demand for us.
Is a lot of this being driven by, the evolution now of, more full replacement programs, buy down into high deductible plans, thus creating a unique opportunity for supplemental health, including vision care, to step in there and provide coverage options that maybe an employee and consumer wouldn't have looked at before?
That's a good question, Doug. It could be. I think probably the awareness of the value of vision care is a big part of it, and I think, as I heard briefly your prior guest talking about the number of people enrolling in the lower tier plans on the public exchange, that people do the same thing. I would assume on the private exchanges would have more money for ancillary and other coverages. Yeah. So you're probably right there.
We talk a lot about transitions. We work closely with them. I know you're a transitions partner, and we talk about vision health. Then the importance of good vision care is identifying, some really chronic conditions, and you're really helping consumers manage their health. Do you see that message getting out more loud and clear right now to the consumers and the employees and through the employers?
Yes, we do. We're seeing we're one of the first at VSP. We're one of the first in the market with our collection of data from eye exams for early indications of diabetes, hypertension, and high cholesterol. And we're having more and more of our health plan partners, as well as disease management companies and insurance companies that are taking in that data and mixing it with the rest of it, part of their overall health management programs. So, yeah, we're seeing a big uptick in that.
Yeah, you've got a unique law that appears to be on the books to be passed, the California Vision Care Council Act out there. What A, is that going to happen? And B, what's the impact going to be there? But maybe, statewide, will this kind of grow across some states?
Yeah, if you're referring to the law that's being led by the California Optometric Association, we fully support optometrists practicing to the full scope of their licensure and increased access. So that's about what I can say on that one.
Okay.
And now, Jeff, going back to kind of the ACA and some of the things that you're looking at private exchanges, how is that allowing vision care to really evolve, with the healthcare law and then the emergence of these private exchanges?
Well, Brent, I think most of the private exchanges are offering vision care plans. They initially we were seeing early days that most of the conversation in the private exchanges was really just around the medical or health plans, and now they've expanded, and then virtually all of them include vision, and we see that as a positive thing. Here at VSP, again, as I mentioned, that our mission is to help people see and make informed decisions about their vision care, and shifting to a consumer focus, which is what the exchanges are doing, I think is good for the consumer and good for their access to a vision plan.
Now, the employers on there, a lot of them, whether it's through the private exchange or even the public exchange, more the private, they have the choice of building out, what the exchanges are looking like with whether it's their broker partner. What's the, when they're looking at a vision partner, what are some of the things that they need to consider when saying, hey, this is the partner that we want within our private exchange platform?
Yeah, good question. Thank you for asking that. Here at VSP, our as I say, we want access and we want people to be able to make informed decisions. And the most important thing that any of the private exchanges offer, regardless if they are a single carrier where the employer chooses which vision plan to offer, or they are a multi-carrier where the employee has a choice amongst carriers, the importance is that they fully understand what the differences are between the vision plans. For example, about 30% of the total cost of vision care is in the premium. The balance is what happens at the time of service. You mentioned transitions earlier as a partner of ours in the photochromics area. The photochromics, the different vision plans have different pricing for that for the consumer when they go to the eye doctor. And so hopefully the most important thing is that the consumer understands those differences so they can evaluate the total cost of their vision care.
Jeff, as you see vision care moving into this market, and you're obviously experiencing great growth, and congratulations on that. Do you see, as consumers become more aware of vision care and the benefits of good vision care, do you see the utilization rising among these consumers that have the vision benefit?
Here at VSP, I think we're seeing the utilization remain fairly consistent. It's rising a little bit in our overall book of business. We're not seeing significant differences amongst our various channels as to utilization amounts. It's fairly consistent across the channels.
Okay.
Now, Jeff, when you look at these exchanges, in your opinion, does it make it easier for that employee consumer to shop for insurance on the exchange?
Well, I think it does because it brings it all into one-stop shopping. As I mentioned earlier, here at VSP, we want people to have and to make informed decisions, and to the extent that the exchange provides quality information for people to make an informed decision, it really doesn't matter if they have a single carrier or they have multiple carriers, because those are the major differences between the various exchanges we're represented on. The decision tools are really important for people to be able to make the right decision for them and their family to get the appropriate care.
Yeah, that makes sense. You're selling across multiple channels. Does that present some conflicts at times, or how does that all work itself out?
Well, yeah, it does, but as a not-for-profit, and our mission is to help people see, we think the more channels that they can access it through, access VSP through, the more opportunity that we have to reach the marketplace. So we are agnostic as to which channel people access us through. And we do have some internal competition, but I think that's healthy too. It's not been distracting, and it really, as you can see, as I mentioned earlier, with the VSP's increase in membership, it seems to be working well for the consumer and for us.
Now, when you look at the book of business, are you seeing, people, your clients moving from direct contract to the exchanges when you look at your current book of business?
We're like everyone else, we're ready, we're poised, that's why we're participating and represented in virtually all of the exchanges. We're seeing still an increasing number of companies looking and exploring the exchanges, and an increase in the number of participants, but not really as rapidly as we had thought maybe a year ago. We think in 2016 and 17 and 15 even, there'll be more and more as it starts to gain in popularity.
Now, Jeff, you guys work a lot through your broker partners. Is there a discussion that you're having with them with all the ACA changes and kind of the new distribution models out there, or is it really business as usual with your broker partners?
Well, that's why, as I mentioned earlier, I think that's an excellent question. That's why, as I mentioned earlier, we've got the various channel partners and VSP. Yes, our largest business is really through our broker partners or direct with clients. Many of those broker partners are the ones that are sponsoring and establishing exchanges, and with them, many of them are competing with each other with their exchanges, or they're simply moving their clients to the exchange. So we have set up a separate group within our organization that specializes in working with the exchanges, that communicates and coordinates very closely with our traditional client and broker people. So we kind of coordinate internally across that as we see companies moving, or we see brokers increasing their participation in their exchanges.
Well, Jeff, we got 1 minute left on the program, and leave our audience with one really good takeaway for them, and then let our audience know how they can find you.
Sure. I think the most important thing here at VSP is, as I've tried to emphasize throughout, is that our mission, being a not-for-profit, is providing access to quality eye care to as many Americans and people in other countries as possible. We want them to make informed decisions, and we believe it's an important part of their overall health care planning. You can get a hold of us, VSP.com, pretty straightforward and simple. We do have offices throughout the country as well. So we really appreciate the opportunity to be with you today.
All right, Jeff, thank you so much for joining us on the program. Have a great weekend. And to the rest of our audience, we will see you next week on Healthcare Consumerism Radio.